We hope everyone's having a fantastic day. I get the opportunity on a regular basis to lecture in regards to legal advertising here in Illinois. And in those lectures, there's typically a really common theme. Now, granted, there's a lot of things that you want to look out for. There's a lot of pitfalls and roadblocks that come into play. But we know that it's really critical to be able to properly market your business because you want to grow your practice, and that's a critical part of the business. However, we also want to make sure as an association that you're doing that legally. It's to not bring any issues and challenges on you as a licensed practitioner here in Illinois, nor your practice. And so in that, what we have found is there's a pretty common theme and a pretty common challenge that our doctors run into when they're marketing, when they're advertising, whether it be, by the way, in social media, online, print advertising, radio advertising, television. It really doesn't matter what the medium is. The rules always apply across the board. So the question really is, okay, so Mark, what is that tool that we can actually prevent a large chunk of the errors, a large chunk of problems that come out for chiropractic physicians in Illinois? It's really actually simple. It's the term misleading. And the question that you ask when you look at your advertisement, you have to put on the hat of a patient and say, would somebody who doesn't know anything about chiropractic, would somebody who doesn't really know a whole lot about the healthcare industry, would this ad potentially be misleading? And if the answer is yes, then it's time to start over. It's time to tweak the ad and make sure that you remove anything that is misleading. One of the common examples that I give, and it's terrible to go back like this because I'm sure that most of you have not even opened Yellow Pages in the last many years. Maybe some of you have never even done that. But Yellow Page is really good example because you can look at this in this context. So there were a handful of chiropractic physicians that what they would do is even if they included the chiropractic physician label in their ad, they would put their ad in the medical doctor section. And the problem with that is then when patients would be looking for a medical doctor in their arena, they would see the ad, they wouldn't look further, they just see the ad, see the name, and dial the number. And the problem with that is, although the ad would have been truthful, even potentially properly labeled with chiropractic physician, at that stage it becomes misleading because the general public would have been misled to believe that the chiropractic physician was a medical doctor. Now we see that in many other realms as well, where something can actually be truthful, but it's also misleading. And so we see some doctors sometimes in advertisements on social media on their website say, I'm a board certified chiropractic physician. Well, the challenge with that is it's absolutely truthful. If you're licensed in the state of Illinois, then you're a board certified chiropractic physician. But that's the problem. By putting that in your marketing, by putting that in your biography on your website or on your social media page or wherever it may appear, what that potentially does is create a misleading advertisement. Here's why it's misleading. All chiropractic physicians in Illinois who are licensed are board certified chiropractic physicians or board certified chiropractors. And by listing it specifically, it generally leads the public to believe that you have a higher level of education. You have something more. Maybe you're a board certified chiropractic orthopedist. Now that would be different. If you have the orthopedic diplomate at that stage, then you would be a board certified chiropractic orthopedist, if you will. And so, so in that realm, you want to make sure that you're fully truthful. And so those are just two quick, easy examples when you look at it that you can say, is this misleading? And so if I put on, here's the test, here's the tool, put on the hat of a patient that doesn't know anything about chiropractic physicians or doesn't know anything about chiropractic care and say, does this ad create something that is misleading or potentially that they wouldn't understand, or more importantly, that they wouldn't, or that they would attribute to something different or hold you out better unintentionally. That's the lens, that's the tool that you can utilize when you look at your advertising. We'll cover a few more of these in the coming months. Take care, we'll see you next week.